Hello and welcome to BOOBSBY, your favorite plastic surgery show. My name is Amadej Lah, I'm your host, and today we are speaking about liposuction. So you will hear everything you need to know about liposuction, about the procedure, the equipment, indications, contraindications, and all of these strange new words like VASER, laser, Lipo 360, high definition liposuction, fat transfer, all about that. So let's get started. What is liposuction? Well, liposuction, as you probably know, is a operation, is a procedure where we use special equipment to aspirate different areas of the body. The most common areas, as you can see in these pictures, are, obviously, stomach, then the hips, this area between the legs, the area between the knees, then the area, this is a very stubborn area of fat here, just next to the breast. And then on the back, there is, of course, the arms, the upper arms area, the back area, the lower back area, and of course, the buttocks and lateral hip area. These are the most common areas that we treat using liposuction. We can treat also other areas because, people have some maybe genetical disorders where they accumulate fat on various parts. So sometimes we also need to aspirate different parts of the body, not just these. So it's very individual, and we plan every procedure individually as it needs to be done according to the person. The equipment we use is special cannulas. This is like a mix of different types of cannulas. These are very long needles. They're not sharp at the end, they're rounded. So we make a small hole through the skin, and we insert one of these, of course, into the tissue below the skin. So the fat compartments are, this is the skin, then there are usually 2 layers of fat, and then below that is muscles or bone or other deep tissues. So we aspirate these 2 layers of fat. Usually we treat the deeper layer. The upper layer we don't touch as much because to leave the surface flat and nice and smooth, so we don't get any holes or something like that. There are areas where we also treat the top layer. We'll speak about it a little bit later. So these cannulas are connected to a device like this. This is called an aspirator, and between them is a hose. That is like maybe 1 centimeter wide, and this creates a vacuum. And when we insert the needles, these cannulas, we aspirate, we pull out the tissues. There is, of course, limits. Liposuction is not a way to lose weight. Liposuction is not loss of weight. Liposuction is shaping of the body. These are 2 very, very different things. To lose weight, of course, you have to go on a diet and you have to do sports. Liposuction is the treatment that we would use at the end of your weight loss. Why is that so? Why cannot I just come to a surgeon and he would just do everything, and I go out nice and of course skinny and slim and athletic, maybe even with 6 packs? Because there's a limit. There's a limit in volume, how much fat can be taken out. Usually the limit is about 5 liters. It depends on the body, of course. If the person is a woman, maybe like 50-kilo woman, the limit there is maybe 4 kilo. If we are treating a guy of 80-90 kilos, we can remove a little bit more. Removing more fat than that would be very dangerous for the health, because there's a risk of course, excess, because when we take out the fat, we also take some of the blood, so the person might lose too much blood. After the treatment, this is what we use. These are called compression garments. And the compression garments are something that we put on the body after liposuction. So this is something that a person wears about 1 month after the surgery. Speaking about the procedure, it's usually done in general anesthesia. For smaller areas, maybe just area like maybe double chin. Of course, we do local anesthesia. Maybe if also there are smaller deposits, maybe in the stomach, we might use local anesthesia. But usually we do it in general anesthesia. So the person is sleeping, and we have time to do it in nice calm way without the person having pain or doing any movements during the surgery. The surgery usually takes about 1 to 2 hours. It depends, of course, the amount of fat and the areas that we treat. After the surgery, we would put on the garment as I showed you before. The holes or the scars to do liposuction are small. They are just like 0.5 centimeters long incisions where we insert the cannulas. So usually after a few months, when the scar is formed, it's practically invisible. And apart from that, we also use, of course, areas where we can hide the scars, so it's below the underwear, where it's not visible, and so nobody would notice that the procedure has been done. There's of course limits to the surgery. As I said before, there is limit in the amount of fat that we can remove. The other limit is the quality of skin. If you imagine a balloon, if you deflate it, the surface becomes irregular. It gets wrinkles. It's not smooth anymore, and it's the same with our body. So if we remove too much fat from a certain area, and the quality of skin is not perfect, the skin will not settle well. It will not be. After the surgery, it will not stay smooth, but it will get wrinkled. This is especially true in the areas like the stomach. The stomach is a very difficult area to treat, especially with people who have bad quality of skin. It's usually the women after having kids, their skin is already stretched, and removing more fat would cause even more laxity of skin. And of course, these are cases where liposuction does not work well, does not help. These are cases where we do other procedures like abdominoplasty. So tummy tuck, it's where we remove the skin. We will talk that maybe next week. So, but there are areas that are really react really well to liposuction, and there is never excess of skin. Like the lower back area, it's a very common area that we aspirate. It makes the waist slimmer, especially when we combine that with some sort of procedure on the buttocks area. So we slim the waist area and enhance the buttocks area, and from this flat, from the square body shape, you get a nice hourglass form of waist and the buttocks. Apart from that, a very common area for women are the knees from the inside. It's an area that I have never treated men in my entire career, but with women it's very common. So because I don't know why, but women are really fixated to this problem, this area, so the inside of the knees. Okay. Apart from that, what I also wanted to say is let's maybe go to certain specifics of liposuction, or certain new words that you hear during liposuction presentations and videos. I have written about 10 of these words, and I'll explain each of them what it means. So, laser liposuction. Laser, everybody know what laser is. It's the light of single wavelength, and laser is being used, of course, to help in liposuction. It's used as a special. We use it through a special cannula with an optic fiber, and we go under the skin using this fiber. So we use special wavelength of laser to dissolve the fat. That is one function, and the other is to heat the tissues so they shrink a little bit. So that might help a little bit to prevent the excess of skin, so the skin would get tighter. Plus, it dissolves the fat. So when we do the liposuction, when we're sucking it out, it's much easier because the fat is not in form. I mean, it's not. I mean, it's hard. It's not hard, so it gets liquid. So of course, when you aspirate, it's much easier to take it out. Then VASER, with the V, VASER, is in a way similar but more modern technique. VASER is using not laser but ultrasound to dissolve the fat. So the solid fat using VASER, special cannula again, gets liquefied. Apart from that, it dissolves the fat area, but it does not do any harm to vessels, to veins and arteries. So, and apart from that, of course, the heating effect also makes the tissues around the fat tighter. So, in a way, similar to laser, but VASER is a little bit more modern, in my opinion, a little bit safer, less heat damage, but very useful help in liposuction. In the last few years, another technique has been used a lot. It's called PAL, P-A-L. That's power-assisted liposuction. Power-assisted liposuction is something that we also use at our clinic. It's a special device that is causing vibrations, small movements of the cannula, like maybe a few millimeters back and front, and that helps us to do liposuction. It actually, usually during liposuction, we had to move the cannula back and forth, but using this system, it's much smoother and it's much easier for the surgeon to do it well. The most, let's say, up-to-date or modern combination is doing VASER, so ultrasound plus PEL plus power assisted. This is what we do now, and this is the combination that is being used by the best centers, best plastic surgeons on the planet. Then what is high definition liposuction? This is again a little bit newer word, high definition liposuction. It's an evolution of this classic liposuction where we just remove the excess of fat and that was it. Using high definition liposuction, the procedure is much more precise. So during this procedure, we of course remove the lower layer of the fat. Not the one that is just beneath the skin. So of course lower, like classically, like we used to. But now with high definition, we also treat the upper layer, and using this technique, we can actually sculpt the skin and the surface much more precise than before. To do that, usually you need VASER, you need power-assisted liposuction. Not completely necessary, but usually you do it in this combination. So this way you can do stuff like six packs. I mean, not real six packs, but fat six packs, but they look quite nice. You can sculpt the sides of the stomach. You can sculpt the back, and all these areas much more precisely. So after the treatment, the shape of the body is perfect. Then the next thing is Lipo 360. Lipo 360 is it's a new word that's supposed to present a procedure where you would treat the body all around. I mean, it's not nothing new, just the word is new. So Lipo 360 would mean that you would sculpt the stomach, the sides, the lower back, and of course, apart from that you would also treat the buttocks, enhance the buttocks, and remove the fat from the areas around it. So Lipo 360 would mean, let's say, a holistic approach to the body using liposculpture, liposuction, fat transfer, and stuff like that. So fat transfer, what is that? Fat transfer or fat grafts, it's a procedure where we remove the fat from certain areas and we inject it into other areas. It's very popular in the last maybe 5 years, 10 years, also for bigger areas like the buttocks shaping. The procedure for where we use fat transfer to treat the buttocks is called BBL, or Brazilian butt lift. It's a procedure where first we remove the fat, as I said before. We just aspirate it, we put it in a sterile bottle, and afterwards we fill some syringes with this fat, and we inject it into the areas where the fat is missing. Usually, there are 2 areas we use that for, or maybe 3. Okay, face, but we're talking about body now. So one is breast, so to augment breast using own fat, and the other is the buttocks area. Me personally, I do not like doing breast with lipo transfer, fat transfer, because I feel it doesn't work that well. But for the buttocks area, it works really well, and really well. And the percentage of fat that survives there is much higher. So in the last few years, usually when we're doing liposuction, we also do fat transfer into a certain area. There are very few cases where we would just remove the fat and toss it away. So fat transfer. What is lipolysis? The lipolysis is a procedure that sounds really nice, really attractive, really catchy. So it's a procedure where you just dissolve the fat, and that's all. It can be done in different ways. You can use chemical agents, so using injections. You just inject the product into the fat, and once inside the fat gets slowly dissolved, and then the body metabolizes this fat. It sounds really simple and nice, but it's not so nice, because first, it's okay. It's acceptable for very small areas, not like a stomach or something, just small areas. And you must understand that when you inject this material into the fat, when the fat gets dissolved, there is the process of metabolism of this fat, which is usually there's quite a lot of swelling and pain involved. Me personally, and I prefer doing liposuction. Also doing lipolysis, it's a procedure where you have to repeat the procedure maybe 2 or even 3 times to get the result. Liposuction, you do it once, you see what you have made, and there's an immediate result. One more thing are the stem cells. Stem cells are the small cells that are present in our body, and stem cells are also in the fat. So in the last few years, also the liposuction to remove fat, and also to take out the stem cells and conserve it for maybe potential later use, is becoming more and more popular, because we know that stem cell therapy is becoming more and more popular. So you are doing liposuction, a part of your fat goes to these special freezers, where it's being held for 20 years, 40 years, whatever. And if you need the stem cell therapy, then you would get it back, and of course it would be used on your own body. The result of a liposuction usually lasts a long time. It's where we do the liposuction, we remove the cells. So these areas are then less prone to gaining weight. So if I would do liposuction of the stomach, even if you gain some weight, it will not be accumulated in the stomach area. Everybody must understand, of course, that if you eat too much, the fat will get accumulated. It's not that it will just disappear. So if the weight is more or less stable, the result is stable. And the other potential problem is the hormonal change. So if your body's hormonal status is changed, also there can be fat accumulations in the areas where we have done the procedure already. So that's all from me tonight. Thank you very much for watching, and we see you tomorrow with another edition of Boobs by Plastic Surgery channel or show. Yes. Oh yeah. Just for the end, this is me doing liposuction using power-assisted device. Well, it looks quite scary, but in reality, it's not that bad usually. Bye bye.